Maybe you've heard about Medicare Supplement Plan GHD or Plan FHD, and you're not quite sure how they work. Some people may have told you, stay away, they're too expensive or they cost too much to use. And it's really not the case. And I'm going to show you exactly how it works so that you understand it. And then if it's right in your situation, it's certainly an option to consider. So we're going to talk about Plan GHD or HDG, however it is phrased and put out in front of you. And what the HD stands for is high deductible. So kind of scares you away right at the beginning, because who wants a high deductible? Well, the only reason to have a high deductible is if it brings a premium down significantly. And that's exactly what it does with Plan GHD. But let's understand how it functions so that we know if we go to use it, how it's going to work. So when you have a Plan GHD, you're going to be on original Medicare, Part A, Part B, and then your supplement, which you want to have cover what A and B do not. If you are to choose Plan GHD, and I'm going to show you in just a second when to choose it and where to choose it, but let's understand how it works first. It has a high deductible, so it has a $2,700 a year deductible. Sounds like a lot, but it really is very difficult to get anywhere near that deductible unless you have a catastrophic year. And if you do have a catastrophic year, that's a stop on your out-of-pocket expenses. So how it works is Part A, which is Medicare Original Part A, covers inpatient hospital stuff. It has a big deductible itself. It has $1,600 deductible. Part B, which covers everything outside of the hospitals, doctor's visits, specialist, outpatient, home health care, whatever it may be outside the hospital, has a very small deductible. Right now it's $226 for the year for Medicare Part B. So let's assume we're going to have Medicare A and B, which I absolutely recommend. It's without a doubt the best way to go because it gives you all the control and all the freedom, and we go to use it. So first thing that happens outside the hospital, we're not going to talk about inside the hospital quite yet. So regular stuff, doctor's visits, specialists, whatever it may be, things outside the hospital. First you have that annual deductible of $226. So you are going to be responsible for that $226 Part B deductible. Now if you have a HDG plan, that $226 does not go towards that $2,700 deductible that's on the supplement. Okay, so no big deal. So we've had to come out of pocket $226. From that point on, for the rest of the year, Medicare is still going to pay their 80% of whatever happens outside the hospital. So your responsibility is going to be the 20% of what Medicare doesn't pay, and that's 20% of Medicare approved charges. And if you've ever seen a bill to a doctor or anyone else, it has a big number of how much it costs, and then it has a much smaller number of Medicare approved charges. And that's what everything is based off of, that Medicare approved charges. So you're going to pay your 20%. Medicare pays 80%, you're going to pay 20%. So if you go to a doctor's office and let's say it showed $120 office visit, but Medicare approved charge is $50, then you're going to pay 20% of that, or $10. So it's almost like a copay going to the doctor. So that $10 goes towards that $2,700 deductible on HDG. So what we've done here is we've reduced our premiums significantly. And again, in certain places is where this makes sense. Not everywhere, where prices are pretty reasonable for G or N. And I'll show you exactly where in just a minute. But just understanding how it functions. So it's not like you're responsible for the entire $2,700 before Medicare is going to pay anything. And that's what a lot of people think. That's what a lot of people are told, actually, is they're responsible for everything right off the bat. Not true. Medicare is always going to pay their 80% when you go to the doctor, the specialist, the outpatient, if you have a colonoscopy or if you have a mammogram, anything outside the hospital that's not inpatient care, Medicare pays 80%. You pay 20%. Goes towards that $2,700 deductible. So when might we actually get close to that $2,700 deductible? If you are admitted into the hospital. So if you are admitted into the hospital, Part A has a $1,600 deductible. So that $1,600 out-of-pocket expense does go towards the $2,700 deductible on the supplement. So that deductible goes towards the other deductible. But what it really means is, again, you have a stop. So you have a max out-of-pocket for the year of the $2,700 deductible from your supplement, and then just that $226 from Medicare Part B. So a total complete out-of-pocket maximum $2,926 for the year, which whatever health plan you have right now, you probably have a larger out-of-pocket than that. And I say in other videos, if you're hit by a bus, it's going to cost you $2,926. And then it's going to pay, Medicare is going to pay from there, your supplement's going to pay 100% from there for the year. It runs January to January. So it's not as bad as it seems. So when do we want to take Plan GHD? There's 3 states where it absolutely really is almost a no-brainer to take HDG. And that's in New York, Connecticut, and Washington State. And why in those 3 states? Those 3 states have mandated extra rights on your behalf to allow you to get in and out of supplements without any medical questions or any medical underwriting, and you can choose whatever you want, whether you're perfectly healthy or whether you have a terminal illness. You can get on any Medicare supplement plan that you want, which is terrific, right? Well, in a way, what it does is it makes the price go way up because the insurance companies don't have any control whatsoever. They have to take anybody and everybody. So they're going to raise the premium to the median level of a perfectly healthy person to a terribly sick person coming onto the Medicare supplement. So what that means is a Plan G in those states are generally more than $200 a month, where HDG is generally $60 or $70 a month. And on HDG, as long as we're healthy, terrific, no problem whatsoever. If we ever reach a scenario where we're not so healthy and we're going to be utilizing a lot of medical services, we can jump onto a Plan N or a Plan G the first of next month without any medical questions, without any hoops to jump through. You just put in the application. So it absolutely makes sense to work within the rules that we're given to utilize the lowest cost benefit when we may not need it. And then if we need a higher benefit, we can easily get into it there. Now in other states, there are some, California, Illinois, possibly, Ohio, where prices are also somewhat elevated for other reasons. And where I draw the line is if Plan G, regular Plan G, is $180 a month or more, that's going to make Plan N usually $150 to $160 a month. Then I'm going to look at Plan GHD, HDG, whatever we want to call it, because that premium is going to be, again, $60, $70 at the tops, and we're going to save $1,000 plus in premium over the year to take on a slightly higher deductible that we're not going to reach unless we're in a catastrophic hospital inpatient situation. So, in the old days, we used to have 80-20 coverage. You had a deductible, and then, everybody had their Blue Cross card, and Blue Cross would pay 80%, you're responsible for 20%. That's exactly how it is with Medicare, and what this does is it gives us a stop. So, in another scenario, if you are in a position where you're saying to yourself, I can't afford a Medicare supplement, I'm going to have to go into a Medicare Advantage plan. This absolutely is the way to not go into a Medicare Advantage plan where you can have a low-cost supplement plan and limit your out-of-pocket to less than $3,000 for the year, where your Medicare Advantage plan likely is going to have an out-of-pocket maximum of over $7,000 a year. Crazy on the out-of-pocket expenses there, but this gives you the ability to stay within original Medicare, have a low premium on your supplement, have super good coverage with no restrictions on doctor networks or hospital networks. You can go where you want to go. You can go when you want to go. You don't have to ask for permission. And it just gives you that peace of mind that no matter what, your medical expenses will never exceed $3,000 for the year. So pretty fantastic in my book. If you want to get a little deeper dive, give us a call, fill out the form on my website, and we'll run through it all for you and tell you exactly what we think makes the most sense. Hope you found this helpful, and we'll show you how to download my free book, Medicare Made Clear, right now. Have a great day. Thank you for taking the time to watch my video. I hope you found it very helpful. A couple of other things that you'll also find very helpful. Number one, download a copy of my free book, Medicare Made Clear. I spent a lot of time and a lot of effort putting this together, and it has everything that you need for Medicare now and in the future, down the road. I have videos in the book. I have all the links that you need for things that you'll want to do within Medicare. You can access it right in the book. Very easy to do. Just visit medicareonvideo.com/free book, and you can download it for free. You can save it on your computer. You can save it on your iPad. It's a great resource to have, again, for now and in the future. Another thing that you'll find helpful is down the road, when you come into Medicare, sometimes it makes sense to do a price check on your Medicare supplement plan. So I made it very easy to do that as well. Just visit medicarepricecheck.com, put in your basic information, and we'll email you a quote on your same plan that you have right now, a G or an N or an F, whatever it may be. And likely we'll be able to save $20 to $60 a month in premium, because a lot of times plans come out with better rates. So if we can get a better rate for the same plan that we currently have, just makes a lot of sense. And then obviously take advantage of all the information on my website at medicareonvideo.com. I have everything that you need right there for understanding IRMA, understanding employer work coverage, everything that you need, especially in the guides and forms section, you'll find right there. So we update everything every year, so everything should be up to date and current with the right deductibles and premiums and things like that. Hope you found all this helpful. Have a fantastic day. Wait, don't go anywhere. There's a couple more videos right here that you'll find very helpful with your Medicare journey. So take just a minute, watch the videos. You can also subscribe to my channel by clicking this button, and that way you'll have access to all my videos for everything that you need for Medicare. Hope you find it helpful. Have a fantastic day.